A very good afternoon to all of you. So I, at the outset, thank Mr. Darshan. I also thank the Bureau for arranging this, and also so I thank Mrs. Purnima for the continuity from the previous talk that we had regarding the COVID accept certain things as new normal. Okay, so as I was telling, so this is the COVID era that we have to willingly or unwillingly accept, and we have to adopt certain measures that will become part of our life. So these are the things that we need to really get adjusted to and even accept as realities of new normal that we are going to face in the new world. So with the focus on precautionary measures during the festivals, because this is a festival season now, so all festivals nearing the end of the year and the beginning of the year with the New Year celebrations and things like that. So the whole lot of celebrations will be coming up by the end of the year as well as at the beginning of the next year. So let us briefly see what is the impact of COVID-19 so far globally. So globally, so more than 70% of deaths have occurred in 10 countries. So a major burden is seen in a few countries, not in all countries. So 35 million cases worldwide and 1 million deaths so far since the beginning of the pandemic. And India's position stands second. So that is where we become very important globally. So next to US, we are standing numbers 2, followed by other countries, and Brazil is third. So once again, just going back briefly to the beginning of the first surge that we saw, that really attracted the attention of the entire world. So that saw a surge in March and April. So at that time, the first surge was seen as a community transmission among the not so vulnerable age group. So then there was a lockdown. We went through the lockdown, and then what happened? We protected our vulnerable age group people. So that explains the slow and steady nature of the curve, the epidemic curve. What we talk about, it has its own shape depending on the region. So it varies from one region to another region, and it is not the same throughout the world, or for that matter, throughout the country, or even for that matter throughout the same state if you take. So it varies because the time trends are different, the socio-demographic details, all these factors, they have an impact on how the infection spreads in the community and how it is controlled, and all these factors become very important in the nature of the epidemic that we face. Then we came into the second surge from July onwards. So that difference was that now the youth who are moving out during the restriction time, they carried the infection to all other family members, especially those who are at home, the more vulnerable, those with other comorbid conditions, what we say about diabetes, hypertension, or heart-related conditions, asthma, or lung-related conditions, or any other chronic illness that they suffered. So that was the stage in July. So from this trend, what we can expect is this may continue as a 3 to 4 month cycle over the next, say, at least 2 years, is what we as epidemiologists foresee as something that could happen. Now coming to Indian scenario, so these are the states, top 10 states that have reported most of these cases as positives. The recoveries also you can see here, how they have recovered, and number of deaths also. So as you see, India is not doing that badly compared to the rest of the world. So, but still, since the number of people in our country is very high, population density is very high, so it is ideal for community transmission in these places where there is overcrowded living conditions that prevail, Especially if you take Maharashtra, why it is number one is because of the same reason, the population density. And Karnataka stands second. So these are the other states that make the top 10. But one striking thing is quite a lot of deaths reported, but still, compared to the rest of the world, we can say that we have been doing very well. So even though we are number 2 when it comes to deaths, but still, these are acceptable numbers given the extent of the transmission that has taken place and the severity that we have faced and the hardship that we have faced, the challenging our health system and also burdening and overburdening our healthcare workers as well as other support staff. So even globally, community spread, take precautions in order to bring down the spread of transmission in the community, because otherwise it will keep spreading more, and what happens is more spread and more vulnerable people will be at risk of getting severe infections that could lead to hospitalization and critical care. So that is the reason we have to be very much aware of the precautionary measures that we need to take. Then most of the cases were detected in June, so it has taken almost 6 months, nearly 6 months to build up in terms of the number of cases or the burden. So again, what we can see is deaths are whatever number of deaths are increasing, they are more due to critical cases. And one point in India is this delay in seeking healthcare. So wherever we have visited in other private hospitals or COVID care centers, the major complaint from all healthcare workers when it came to explaining the deaths in their centers was mainly because of delay in seeking healthcare. Otherwise, if they had reported earlier, they would have been given better care and they would have been saved. So that is what it means. So those deaths, what we have seen are most of the cases, very severe cases, who have not come to the health centers on time for some reason. So various reasons, like we can see the fear, for the example, or stigma that was attached with COVID cases at the beginning of the pandemic in, say, February, March, at that time. So everybody was scared. Everybody was treated like criminals, or so they had a doubt in their mind regarding how it would be taken by the neighbors, by the society. So there was a fear. So the fear was bigger than the disease itself at that time. And it's not very much different now, but although things have changed. So what we have to be bothered is about the clusters that keep moving. So what I mean by clusters is people who just group together, who assemble in a place, and they are potentially capable of spreading infection from one person to another person. So that is how these hotspots develop. So from one person to another person it spreads, and then this could lead to potential cluster formation. So cluster is a new set of infections that can arise out of a meeting, or of a crowd getting together, or a group of people sharing a meeting, or getting together for some purpose, whether it is personal, social, or religious reason. So whatever the cause is, getting together is a big risk. So these are all moving clusters which are capable of transmitting the infection from one small cluster to another cluster, even if that cluster is totally free from infection. So potentially what we mean is, wherever there is movement, wherever there is a meeting place or occasion, there is a chance that the virus can skip from one individual to another individual and can create clusters. And these clusters become bigger and bigger, so that is when the transmission becomes community transmission. So in that situation, what has happened is, at the cluster formation level, we have failed to bring down the level of transmission, or break the chain of transmission, as we say. So the most important thing is to break the chain of transmission by avoiding all these groupings, what we see. So even in hospital campuses, we have seen wherever there is a crowd at the OPD or at the lab or a center, diagnostic center, where reports are given out, then people somehow knowingly or unknowingly, they just tend to get too close to one another, and they don't take care of using masks or distancing, physical distancing, what I mean. So these are all the small measures that we fail to take at that time when people forget about these things. And coming to the mass gatherings, like I said, the smaller hotspots leading on to smaller clusters, and then as these clusters merge, they become massive clusters. And what happens is the spread of infection is rampant now. So that is what we saw during the time period following the lockdown. So that is when most of the restaurants they only allowed takeaways. They didn't allow in-house seating or eating facilities. And then their weddings and party meetings were held, but with restrictions. So then again, more vulnerable people were increased to the risk of getting the infection. And of course, administrative issues are there in the whole world. Everywhere it is there. So we are not used to this pandemic time. So whatever during the normal time the procedure was, it took the same amount of time even during the pandemic. So people were not really prepared mentally to discharge their responsibilities and duties. So that was a hindrance actually. So then coming to the October to December, like I was mentioning, so there have been SOPs issued by the central government. So keeping the festivities in mind, starting from Dasara to Diwali to Christmas to New Year. So a whole lot of things and celebrations would be going on. So keeping these things in mind, the government of India has issued standard operating procedures so that we can adopt most of these preventive measures. So as I was telling you, the events that we are talking about where people get together for celebrations, they may last say for a day on a festive day, or it might continue for a longer period, for a week, or even much longer than that. So if we take up the religious places, so sometimes people have a habit of going every day, visiting every day, or for that matter in a mosque, for example, 5 times a day. So there is an assembly every day for 5 times. So what happens is the number of time of exposure that you are getting will increase, and also the time amount that you spend together at that particular point of time is also important. So the time duration also becomes important. If you are spending more time, there are more chances that you are likely to get the infection or spread the infection to others. So that is about the places of worship like temples or churches or mosques, I was telling. Then fairs. So this depends on the place where these have been followed for years together, and then you will have to see how many people are getting together. Then what is the risk now of coming in contact? So can you impose measures regarding the practice of distancing or using of mask or hand hygiene, things like that. So is there a possibility of making a provision for all these facilities is something that we have to think about. And then rallies, protest marches, or any such group activity or collective activity. Then exhibitions, again fairs and exhibitions. Usually it has become a norm. Every year they will have this at some point of time. Then cultural events, every year some cultural events will be there. And then protest marches sometimes will be there. Protests also happen. They also happen in groups. And at that time people forget that they have to take some precautions. So all these things are there. So these are the events that we are more interested in, especially nearing the new year. So these are all the things that can happen, events can happen. So sometimes it is inevitable, and when you have to have some event, then you should also know what are the precautions that you need to take as people, as the community, and also as administrative authorities, what you need to expect from your community or the people. So that becomes very important again. So coming to the administrative requirements. So like I said, when there are events, the district health authorities would be responsible for planning out and organizing the events in a way that they follow all the precautionary measures and also the SOPs I was telling you laid out by the central government. So then again, they should know where this event is going to be held, identify the area if they have to have it, and then the detailed plan must be made available. And then also they should be very clear whether how many people are entering at a time and how much time are they going to spend in one particular place. So then are there risks? Do you need to provide hand washing facilities or sanitizing facilities? Distancing must be ensured. So these are all the measures that need to be taken at the administrative level. And also what is the number of people that is fixed or should not exceed. So these are all certain norms that are given out by the central government. So again, regarding physical distancing, wearing of masks and appropriate wearing of masks, that are covering the nose and the mouth. So otherwise we see everybody is wearing a mask, but it's not covering either the face, either the mouth or the nose. It's like that. So just to avoid being fined, people are wearing masks. So I think they need to be further told that the purpose of wearing a mask is not just to avoid the fines, but also to prevent the spread of infection or droplets that you can transmit while you are coughing or sneezing. So that is the risk in a crowded place or in a public place, where while sneezing and coughing you are spreading more droplets, and these are potential virus particles that are waiting to infect people. So then we have seen everywhere thermal screening is done, but it is not very much reliable. Thermal screening is not the only one that you can rely on. You will have to rely on a whole lot of things, including mask, physical distancing, even once you enter the grocery store or a supermarket. So again, this has to be ensured. So there must be someone from the local authorities also, for example, in a mall if they enter or in a supermarket. The workers also must keep a watch on all these things and ensure that in a nice way people are made to accept these norms that have become new for us. And then regarding sanitization, facilities must be provided. That we can see that's the only thing that has been provided by the shopkeepers especially. Then we may need to have ambulance services also available, so wherever there is an emergency, so we may have to look into that. So how well the authorities or the administrative authorities have provided the ambulance facilities. So then volunteers are very important in a case of a pandemic or any situation that arises as we see today. One thing what we observed at the beginning of the pandemic was not many volunteers were coming forward. So I had my own personal experience talking to so many NGOs, and they were ready to work. But when we asked them that you have to work in such a place, say for example, you have to work in a hospital setup or you have to work in a setup where you need to come in contact with the public, so they were really hesitant. So even though they were volunteers already doing their jobs very well in normal times, but during pandemics, being a volunteer is a challenging task. So it is human. Everybody is scared, everybody is afraid, everybody has a lot of doubts and apprehensions. But then we really understood who is a real volunteer at this stage. So getting volunteers is not easy for anything, especially managing cases here. And then even in many places, CC cameras were not available. So that is one of the means of ensuring, like I said, wearing of masks or distancing, and then various other preventive measures that need to be followed. So that is what is to be impressed upon to everybody else wherever there is a crowd. Then coming to further ensure that entry and exit, people should not come into one another. They should be separate. Entry, exit must be separate. And as far as possible, multiple entries and multiple exits must be ensured wherever such an event is being held, even in religious places also when they are entering a temple or exiting a temple. So they have to make sure that these orderly following of entry and exit is also practiced. So it becomes a whole lot of responsibility not only among the people that are coming to the temple, for example, but also on the authorities of the temple to ensure that these things happen in an orderly way, and unnecessarily some people are not spending more time inside while others are waiting outside. So these are all certain things that we need to practice, and also ensuring adequate natural ventilation. Natural ventilation is the best. So use of AC or even fans unnecessarily in a crowded place is not going to help. So natural cross ventilation and ensuring that the number of people who are moving in and out, everything is regulated well. Only these things, less risk of transmission of any infection for that matter. And then when it comes to the staff and visitors, they must both be screened for symptoms, or they should themselves on their own not report for duty if they have any symptoms. So that is one of the things that we need to ensure among the staff, especially who are working in these places wherever. So then safe drinking water must be made available. So that is also to be taken care of. Wherever there is an event where people are more. And earlier we used to discourage disposable cups, but now we are again encouraging disposable cups for this purpose. So during the pandemic, we have to support the use of disposables, and also once they are collected, again disposal of these wastes is also to be done in a very safe manner, especially from public places. Then in some religious places, there may be a practice of touching the books or idols. So these things are to be avoided. So this should not be allowed. So it's in a nice way, we can explain to the people that this only increases the risk of spreading the transmission, spreading the infection to others. So by avoiding this, they are doing a service to humanity. So that is one thing that we can impress on. And if there is a big crowd of people gathering somewhere, if there is a surface which is likely to have been touched by many people, so that should be disinfected regularly and frequently. And then when it comes to music, especially on occasions, music is there. Usually earlier played by live bands or people themselves, but we have to encourage people to play recorded music, avoid anything of this sort, like singing. Singing is like talking loudly, or singing can spread. It's like coughing and sneezing. It can spread the virus to longer distances. So it's better to avoid these live bands, especially during events, whether they are religious or any other social related. Then, like I was telling you, no single tool is effective to impress again. So we have to use each and every tool that is available. Whatever that is, however small it looks, however insignificant it might look. But together, if we use everything, let's say starting from hand hygiene, washing of hands, using a sanitizer, then, like I said, appropriate use of masks covering the nose and mouth, and then mask hygiene. Mask hygiene is disposable masks have to be disposed of, or washable masks have to be washed and used again. And what is the hygiene? Just like taking care of your handkerchief. So we are used to using our handkerchiefs and then maintaining the hygiene. So similarly, we can also maintain the hygiene of our masks also. So that is the importance of hygiene that you can ask the people to follow. And then this habit we can discourage even especially children touching their eyes, nose, lips. So it's very natural to do all this. But when you move out in the public, in places, in public places especially, then you get used to this habit also. So it has become a norm now. Like we don't touch our eyes or mouth necessarily when we come out of the house. So once you get inside the house, then it's fine. But outside in public places, we are not supposed to do all these things. Is gradually we will learn these things, and then even cough and sneeze etiquette. So how to cough when? So it's better now to have a mask. So when you cough, you are protected. Others are also protected. So in the event where you are not wearing a mask, suddenly if you get a cough or sneeze, it's better to cough into your elbow to make sure that it doesn't spread the droplets to other places. So that's also something that is improving as a behavior in our society. It will catch up, and we will all get used to this also. Then respiratory hygiene, especially early morning, cleaning the nose and cleaning the oral cavity. All this we have been doing, we are supposed to do, but then we have to take extra interest and extra precautions regarding respiratory hygiene. So that helps if you blow your nose well or keep your oral hygiene good. Then that is also going to prevent the spread of viruses, especially during this time. And then use of gargle can be encouraged. Any gargle can be used, or salt water gargling can be done. So these are all the measures that can always help. So once you go from a public place back home, so we have to follow all these things before we get in contact with other family members especially. So that is very useful. And then physical distancing is very important, and this is one thing which has not been followed by our people especially. So this I think we need to stress more on. Distancing is more safer than just wearing a mask. So distancing can prevent spread of droplets, and it can ensure that you are not going to be at higher risk even if somebody else is there who is coughing or sneezing. So then psychological well-being is very good again. So we always talk about physical distancing, not social distancing. It started as social distancing in the beginning, but now we don't talk about social distancing, but we only talk about physical distancing. So on the other hand, we say socially you have to be connected. So whether you are using any phone or any other media, you are connected socially. So that is what we are talking about. And then that helps you to overcome the inability to meet physically or greet people. So that is one more thing that we can improve. So once again to highlight, we have to use all the public health tools that are available. These are the best tools that need to be used by everyone. Then coming to the role of the community. So like I mentioned again, in the beginning there was a lot of stigmatization and incrimination of these people who turned out to be positive. So then neighbors used to talk about them, this person is negative, or the household there somewhere along this line is turned out to be positive. So it was as if it is their sin, or it is something that has happened, shouldn't have happened, or something like that. So this is one I think we further need to educate our community regarding. We have to accept everybody is at risk, anybody can get this infection, but when someone gets it, so how do we treat them and accept them rather than stigmatize them? It's something that we need to accept. And then we have to make use of the health workers, especially. The healthcare workers are the best people who can tell you like what is happening, how it is spreading, how it is being controlled, what is the role of the community, what people can do. So all these things are well understood by the local healthcare workers or the peripheral healthcare workers. And then there are public health experts who are available to answer certain questions, to demystify the myths that people might be having in their minds. So scientifically we have to explain. So unnecessarily wrong things should not overpower what the people think about. And then engaging and empowering the communities. So what happens is once you win the trust of the people also will win the trust of their authorities, the administration. So most importantly, the local political leaders and the religious leaders at the local level, so they should be involved. Although in theory we say they are all involved, on paper they are all involved, but in spirit, this is where the reality is. We need to involve these people and encourage more interactions between these political leaders, religious leaders, and the community, the common man. So they have to share their own experiences and then identify what are the risks that their community faces or their locality faces. So they understand the situation much better than anybody else. And then coming to the behavior change, like I said, it takes a long time for any behavior to be accepted as a new one. Whether it is one person's personal behavior, so it's difficult to change. So when a person's own behavior is difficult to change, community behavior also doesn't change much. So then that administrative behavior in normal times is acceptable, but administrative behavior during pandemics, what are the changes that they need to develop, they need to bring in, and what about the restrictions that you have as policy making, especially during a pandemic? So there are certain relaxations that you need to bring in, accept that yes, this is necessary, this is not a normal time, this is a pandemic time, and then while there is a pandemic, we can't behave in the same manner in which we used to behave earlier. And we need not be authoritative all the time, giving directives, ordering something all the time. We need to get with the public also, join them, and then understand their problem collectively, and then try to bring about some solutions to these things. So these are all certain terminologies that I have used which during normal times mean different. Health budget, for example, public health infrastructure, disaster, outbreak, preparedness. So these are all the things that have a different meaning in normal times. But when it is a pandemic time, we have a special meaning. And a country that handles these things much better, much sensibly, is the country that emerges more successful in handling this particular pandemic. So it becomes very difficult for us to change the behavior of the people going to a temple or having a celebration, for example, on Diwali. So they still know that this is dangerous, this behavior is dangerous, smoke is not good for so many people. So it only adds to the risk of severity of the disease. So all these things are there, but then they still think, no, we cannot change our behavior, we cannot change our culture. But then these are all certain things we need to bring in at the individual level. That is why I said this is more important. Individual behavior is more important. Then gradually it can become a collective behavior. Then one more thing to talk about the administrators is there is always one-way communication. You do it this way, or the directions are given, or something, the instructions are given, or SOPs are given. Okay, fine. These are all the ways in which things have to be done. But what about getting the feedback, talking to the community, winning their faith again, and trying to understand what basic problems they face? So that is what two-way communication is more important. So whether there is a religious event, whether there is a festival to be held, what does the community feel about it? What do they think should be the restrictions? So all these things can be decided by having one-to-one communication with the people or the locality. So then there will be a better solution for that without any opposition. And then of course, once all these things are done, you don't be only authoritarian, just giving orders. It should not be done. This is not normal time. And then once this is taken care of, there will be automatically destigmatization and decriminalization, and people will stop blaming one another. So then what we need is more building of faith and trust among one another and as a community. So this is what we need to focus more on. And then risk awareness. Once again, everyone needs to know what action and what that action has as a potential risk. So they should know whether I should do this or I should not do this. So whether I should go to a supermarket or I should send someone who is a 65-year-old or a 70-year-old to get something for my grocery. So these are all the decisions that people should take depending on the risk awareness and what is the risk measurement, for example. So you can assess or measure your own level risk at individual level. So every person must be sensible enough to find out, okay, what is my risk today? I'm talking about day-to-day risk. It is everyday's risk. Today you are at risk. Tomorrow again, when you come out, you are at risk. So today, what is my risk? What is my level of risk? What precautions do I need to take? When I get back home, what do I need to do? Then how to protect my vulnerable at the family level. So these are all the things that you start measuring. You don't have to have a tool for that. You don't have to have a scale or an instrument to measure, but you have to develop mentally what is the level of risk that you are exposed to. Now, to give an example, Africa has done very well when it comes to winning the trust and faith of the people. So the African community understands the roles and responsibilities much better because they have faced a lot of public health problems and issues and so many problems constantly. But so that is how they have become very much stronger and resilient. So that is one of the dimensions that we need to work on in countries like ours, especially. So priority is community. Community must be given importance. They must be given to understand that they trust one another, or the government trusts the people, or the people must start trusting the government. So these are all the things which are very difficult for us to ensure, but we can work on these things. And then coming to the meeting places and time together spent, this is very important. This has to be highlighted because I would like to stress on enclosed spaces. So wherever there are meetings, gatherings, groupings, indoor risks are very high, especially if there are few windows or ventilation is not good. Then there are very high risks, high chances of spreading the infection in such places. This usually happens in all meetings, most of the meetings, because earlier they were all air conditioned and there were no windows. So now what they have done is shut off the ACs, but unfortunately windows are not there to open. So it becomes a bigger risk for people to attend a meeting in such a place. So those places are to be avoided, especially in offices. This is, I think, most of the healthcare workers or the administrative staff, they are getting infected only in meetings, is what we understand. If they are not taking adequate precautions, they are at a very high risk to getting the infection. So when doors or windows are available, ensure that natural ventilation is there. Keeping them open is the best thing to happen. So those are the safe places, safe rooms where there are doors and windows open, natural ventilation is happening. So that's all you need to ensure to prevent the spread. And again, making sure that more people are not crowding in that place. Then, if at all there has to be a gathering, outdoor is safer. There has to be any bigger gathering, make sure it is in the open air. And of course, even if it is in the open air, distancing, masking, and all these things are to be in place, and hygiene especially. So all these to be together to be practiced, especially in festive occasions when guests keep coming to your house or all these things are happening. Then at least ensure that some of the precautions can be ensured. Now, like I said, 9 months, 10 months into the pandemic, everybody is facing what we call prevention fatigue. So, at the end of this, if we are having festivals, but if we are affected by fatigue, then it is very difficult for us to manage this, either at the community level or by even the administrators also. So, everybody fails. So, everybody is worried about the fatigue. Enough, how long can we keep doing this? So, but then again, reinforcing the same old things and ensuring that the people really understand it is good for them, good for their families, good for their people, then they will always appreciate this, and then they will get back to the same preventive measures and also adopting all the tools that have been successful till now. So even demotivation will be there, but we have to support people, help one another, support our neighbors. So we should not be complacent. So we cannot be hopeless also. So these are all the things that keep coming to us. Psychologically, we will be affected, saying how long will we keep doing this. So, but then we never know. For another year or so, we may have to do this. So then this is again the pandemic fatigue. So it has been reported also. It's not that it's not there. All the countries are reporting worldwide. Everybody is complaining about fatigue. All the healthcare workers are frustrated. All hospital staff, they are also frustrated. So, but then what happens? It has to be our day-to-day life. So day-to-day, you need to do these things. So it becomes a part of life. So that's what. In spite of the fatigue, how do you overcome this? Is something that we need to reinforce and then encourage people, support them, and to stress more on faith of one another, trust of one another, people's trust, people's faith, very important for us. So we need to talk nicely to them, we need to be good with them, because this is not a normal time. So we need to take extra care, we need to take extra precautions, extra interest. So again, to stress on testing and tracing, cluster identification. So this, I think, without the support of the people, trust of the people, it's not easy to do. So this is where faith and trust has a bigger hand and bigger role. So again, taking the ownership is important. Not that somebody is asking us, somebody is enforcing, somebody is imposing a fine. So that's why we are doing it. No. We are supposed to do in our personal interest, in the interest of our society, for the betterment of our colonies and of office teams. We have our teams who work with us every day at the office. We have to keep them encouraged, we have to keep them motivated, and we have to keep them. So that is what is called appropriate behavior, COVID-19 appropriate behavior. So it's a whole lot of change that needs to happen. Some things have changed, some things are resistant to change, but some things we can enforce again by reinforcing and rethinking about the benefits that they are going to provide. So even public health experts have been emphasizing on the community participation. So people have a very important role, especially in a huge country like ours. People have a big responsibility, so they need to be supported, they need to be encouraged. Then misinformation and disinformation is rampant. Everybody talks about what is the solution for this. There is some medicine in this system of medicine, in some other system of medicine. Somebody claims that there is a cure. Somebody claims that there is some miracle happening. So all these things are happening, but then people must be supported in such a way that they know from where the trusted sources are and who are the experts who can provide better explanations. So, I mean, media support is very important for us. So, media also has a very important role. Media has to be appreciated that it's doing really well. So, but there are certain things that media can also avoid or ensure that they again verify or cross-verify with the authoritative experts, especially before it is brought to the common man. So, in the interest of the family safety, we need to bring this infodemic, what we call, it is called as infodemic, lot of information. You don't know what is right, what is wrong, what is misinformation, what is wrongly conveyed. So, a lot of things are there that we need to focus on. Then, like to stress more on the previous point, what I said, there are public health experts, there is liable media, authorities, trusted authorities, but then everything must be based on science, evidence. So is there research support for that? Then how can we strengthen the public health infrastructure, strengthening the healthcare system, healthcare workers, then how to bring down the stress and anxiety. So a whole lot of things are there. Thinking about these things is better than thinking about so many wrong things. So solution lies here. We can find solutions as community, as administrators, or as healthcare providers. We have solutions here, only here. So our focus area must be here, and I think the media also must bring its focus to this area when it comes to the pandemic and its management. So on that note, I think I would like to conclude acknowledging the contribution of our institutional PGs and house surgeons and so many other frontline workers who have been doing a wonderful job in managing this pandemic. So we need to continue to support our frontline workers only if we understand that we need to support our people also, and we need to trust our authorities and the government, and we need to support one another. So this is what is the message to all of you. So thank you very much for this opportunity, and once again I thank everyone.